Next is, let's kind of finish the story about the olfactory system. Probably because it's phylogenetically older, it's a little different than all of our other sensory systems. A couple of reasons. One is olfactory information can reach areas, particularly of temporal cortex, without a thalamic relay, making it unique because virtually any other sensory system which we've talked about, somatosensory, auditory, taste, visual, all of those sensory systems required a thalamic relay before the appropriate sensory information reached an area of sensory cortex. The next difference involves the actual olfactory nerve. There is no such thing as an olfactory nerve because the olfactory nerve is simply an array of primary olfactory neurons that are embedded in the mucosa in the upper part of the nasal cavity and whose filaments traverse small openings in the cribriform plate of the ethmoid bone to enter the anterior cranial fossa. So not only are those primary olfactory neurons not arranged in a nerve, but they are also, and therefore their cell bodies are not in a ganglion, they're also capable of being replaced. So our primary olfactory neurons, typically in mammals, are turned over about every couple of months. And then finally, patients that have olfactory deficits develop either hyposmias, dysosmias, or anosmias, assuming that the lesion is complete. And a common cause of olfactory deficits are skull fractures that lacerate or fracture the cribriform plate and tear the central processes of the olfactory nerve filaments as they pass through the plate to terminate in the olfactory bulb. And since the olfactory bulb is actually an extension of the central nervous system surrounded by meninges, and since the bulb is closely tied to the cribriform plate, it's common in patients with cribriform plate fractures that develop the related dys or anosmia to also have CSF rhinorrhea because of the close proximity of the bulb, obviously, to the subarachnoid space. So these patients are likely to have skull fractures, tear the olfactory filaments as they go through the plate, and have clear, sticky fluid dripping transiently through one or both nostrils.